Why does an acute panic attack cause tetany or tingling around lips? Well, this is very high yield USMLE concept. Before I start breaking it down, I will ask one simple question: that what acid-based disturbance does an acute panic attack produce? Yeah, it causes an acute respiratory alkalosis. Actually, when you have a panic attack due to sympathetic activation, due to sympathetic response, you get hyperventilation and tachypnea that blows off carbon dioxide from the blood, and carbon dioxide in the blood actually produces carbonic acid, and when carbon dioxide is removed from the blood faster than the body produces it, so that lowers the blood partial pressure of carbon dioxide, PaCO2. So more carbon dioxide is removed, it means less protons are produced in the blood, so that favors or shifts the blood pH in the favor of an alkalosis. And this acute respiratory alkalosis occurs quite quickly, within minutes. Before explaining further, I will ask a question: that what would be your bicarb levels at this moment? Yeah, they would be normal. It takes about 12 to 24 hours for the kidneys to modulate your bicarb levels. So your carbon dioxide would be low and your bicarb would be normal, and your pH would be high at this point. And then there is a protein in your blood called albumin that is present throughout in your blood, and albumin has negatively charged binding sites present on it, and protons produced from dissociation of carbonic acid and the free ionized calcium ions. So calcium, about 45 to 50% in your blood, exists in the form of free ionized state, that is the active form, whereas about 40 to 45% of calcium exists in the form of bound to proteins, that is the inactive form. Now the free ionized calcium ions and bicarb and hydrogen ions compete for those negatively charged binding sites on your albumin. So when there is hyperventilation, carbon dioxide is blown off and is removed from the body, low levels of protons are being produced. So it means more calcium ions, free ionized calcium ions, bind those negatively charged binding sites on the albumin, which in turn reduces the active calcium ions, active form of calcium ions in the blood. And you should remember that even a modest decrease in the levels of free ionized calcium ion concentrations increases excitability of the nerves and muscles, because it makes the opening of the sodium ions much easier, and which in turn leads to muscle spasms reflected by tetany, or you see tingling around the lips and cramps. But you do not see these signs in all the patients, especially those patients who have low baseline stores of calcium or magnesium or vitamin D stores. They're particularly susceptible, are those who have anxiety disorders, to these panic attacks induced tetany or tingling around lips. How do we manage this condition? We just have to rebreathe the carbon dioxide by breathing into a paper bag or cupped hands. And sometimes we can use benzodiazepines to relieve the anxiety as well.